From the demographic screen, we can go to encounters by clicking the left-hand navigation. To create a new encounter, we'll hit the drop-down arrow and then select HSI. This gives you a brand new HSI. On the left, text headers act as navigation. You can switch to any domain by just clicking its header. Let's start in the overview page. 3 text boxes will allow you to give some color or your own words to describe your patient. The chief complaint, the patient's perception of treatment needed, and the present situation. As you type, the text boxes will expand, allowing for easy editing. The first item in symptom severity makes you choose between mental health, substance abuse, or both mental health and substance abuse diagnosis. You can also select eating disorder as a focus of treatment. In item 2, a type ahead field allows you to search by diagnosis via diagnostic codes or the name of the disease. I type in part of anorexia and the system will complete it. I can also search for a diagnosis by clicking the magnifying glass. Next, we'll want to verify the diagnosis. This brings up DSM. Pop-up window will allow you to select different symptoms. By clicking submit, you'll get a verification status, whether the diagnosis was met, not met, or even suggestive of. Access to diagnosis follow the same pattern. If you had a substance abuse patient, you can go ahead and click on these values to help describe your patient's substance abuse problem. If the patient has an intoxication or withdrawal diagnosis, another pop-up window the radio button will open a dialog much like item 1. If the patient requires medical attention, click the checkboxes accordingly. Further text boxes, such as patient's own perception of their chemical dependence and their psychiatric, mental health, and substance abuse history, can be filled in to give the provider's perspective of the patient. If the provider has any other comments that they want to leave in the report relevant to symptom severity, they can do that in the last box. We'll go ahead and save and update the record.